All right, today we're going to talk about something that can cause a whole lot of stress for expecting parents. Seeing the term soft marker on a fetal ultrasound report. Any little note on a scan can be pretty unnerving, but we're going to break down exactly what this means, using the facts to cut through the noise. So, let's dive into what the science really says.
So picture this. You're in the ultrasound room, or maybe you're at home reading the report later, and you see that phrase, and bam, your mind just starts racing, right? It probably jumps to all sorts of worst-case scenarios. And hey, that's a completely normal reaction. Medical jargon is intimidating, especially when it's about your baby.
Okay, so let's just get right to the most important thing you need to hear. A soft marker is not a birth defect. It's actually a pretty common observation, and by the end of this, you'll get what it really is, so we can finally separate the real facts from the fear. So, what does a soft marker really mean then? How do we make that shift from feeling anxious to actually understanding the facts? Well, a really good place to start is just by looking at the numbers.
Just let this number sink in for a second. Soft markers show up in 10 to 15% of, get this, completely healthy babies. Think about that for a minute. This isn't some super rare, alarming thing. It's a pretty common finding, especially now with the kinds of scans we have. And this right here is the absolute key difference. The best way to think about a soft marker is as an anatomical variation, kind of like having a mole on your skin or a unique eye color. It's just a feature. It is not a medical flaw, which would be a real, actual problem with how an organ is built or how it works. It's a variation, not a defect.
You might be asking yourself, well, why are we seeing these so often now? And honestly, the answer is pretty simple. Technology. Our high-definition ultrasounds today are just unbelievably precise. We're seeing tiny little details that were totally invisible even just a decade ago. We're just seeing more because our tools are so much better.
So let's make this all a bit more real. We're going to walk through 3 of the most common soft markers you might actually see on a report. We're going to demystify each one: EIF, CPC, and echogenic bowel.
First up, we've got the Echogenic Intracardiac Focus, or EIF. It sounds super technical, right? But all it is a tiny, bright spot that the ultrasound picks up, usually in the left ventricle of the baby's heart. On the screen, it just looks really bright, almost like a piece of bone.
And here's the best way to picture it, honestly. Just imagine a tiny little freckle inside the heart muscle. I mean, a freckle on your arm doesn't change how your arm works, right? It's the exact same idea here.
So let's get down to brass tacks. What's the clinical reality? An EIF has absolutely zero impact on how the heart functions. It is not a hole in the heart. It's simply a tiny spot of mineralization, a bit of calcium, and it's actually really common in some populations like people of South Asian descent. Okay, next up is the Choroid Plexus Cysts, or CPC. And I know that word cyst can immediately set off alarm bells, but in this context, all it means is a small space filled with fluid, and it's found in a part of the brain that's job is to make the fluid that cushions the brain and spinal cord. A really good way to think of it is like a tiny bubble or blister that just kind of forms while the brain is going through this incredibly complex wiring process. It's often just a temporary little blip in that amazing developmental journey. And this is so important to hear. A CPC is not a tumor. It's not even in the thinking part of the brain. And here's the kicker. 95% of them just disappear on their own by about 26 to 28 weeks. They have absolutely no effect on a child's intelligence or skills down the road.
And our third common one, echogenic bowel. This sounds strange, but it just means the baby's intestines look brighter on the ultrasound screen than the other organs around them, sometimes as bright as bone.
So why would it look brighter? Well, most of the time, it's caused by something totally harmless. Like maybe the baby swallowed a tiny bit of blood earlier in the pregnancy, which doesn't hurt them at all. Or sometimes the amniotic fluid is just a little thicker when the baby swallows. The key thing to remember is that, just like the others, this usually completely resolves itself by the next scan.
Okay, so your doctor spots one of these. What happens next? What's the game plan? Well, the most important thing to know is that the response isn't to panic. It's a calm, methodical, data-driven approach. They follow a really clear set of steps. First, they check if the marker is isolated, which is just a fancy way of saying, is it the only thing they see? Then they'll double-check your initial screening results, like from your NIPT. If those were low risk, that's a huge green flag. They'll also do a very detailed scan to make sure there are no hard markers, no actual structural problems. And finally, they'll usually schedule a follow-up scan later on, just to see if the marker has gone away, which most of the time it has.
All right, let's do some serious myth-busting now, because this is where a lot of the fear and anxiety really comes from. Let's pit the myths against the actual clinical reality.
Big myth number 1. An EIF means my baby has a hole in the heart. The reality, an EIF is just a reflection the ultrasound waves make when they bounce off that tiny calcium spot. It is not a structural hole, and it has absolutely no effect on how the heart works, period.
Myth number 2, a brain cyst, a CPC, means my child is going to have learning disabilities. The reality, and tons of research backs this up, is that there is no link, zero link between an isolated CPC and a child's IQ, their personality, or their long-term brain health.
And the third big myth, seeing a soft marker means you have to get an invasive test like an amnio. The reality is, if your initial screenings all came back low risk, and this marker is the only thing they see, then recommending an invasive test is actually very, very rare.
So after digging into all those details, let's just zoom out for a second and look at the big picture here, because it is so important to put this one little piece of information in the context of the whole pregnancy.
I heard these markers described once in a way that I think is just perfect. Think of them as scenic detours, just harmless little anatomical features you see on the path to a healthy delivery. It's such a great way to frame it, right? They're just something you notice along the way, not something that changes your destination. And you know, this kind of leaves us with a really big modern question, doesn't it? As our technology gets even more amazing at spotting every tiny little scenic detour, how do we find the right balance between having all this information and having peace of mind? How do we use it, not as a source of anxiety, but as just another piece of the puzzle, confirming that things are unfolding just as they should? Something to think about. Thanks for tuning in.